Welcome to Period Stories. My name is Dr. Asensio, and today we'll be talking about sexually transmitted infections. This is a part 3. We'll be speaking about hepatitis B, a viral sexually transmitted infection. Now, hepatitis B is a vaccine-preventable disease. You get the vaccine, and the risk of you getting this disease goes away. It causes an inflammation of the liver, and it's transmitted when blood, semen, or other body fluids from an infected person enters the body of someone who's not been infected. Now, you can get hepatitis B. It can be spread at birth from an infected mom to baby. You can get it through having sex with an infected partner, sharing needles, syringes, or other drug preparation equipment, toothbrushes, razors, medical equipment such as like glucose monitor, with an infected person, or with direct contact, open sores or blood, such as from a needle stick. Hepatitis B can survive outside the body for about 7 days, so pretty fastidious. And if you get infected when you're younger, you're less likely to clear the infection and more likely to end up with a chronic infection. If you're older when you get exposed to hepatitis B, it's more likely that your immune system will clear it effectively. Now, what are some of the myths about hepatitis B and how it's transmitted? Some of the myths are you can get it through kissing, and that is not true. So, can't get it through kissing, through hugging, sharing water or food, sharing eating utensils, breastfeeding, hand holding, coughing, or sneezing. Now, acute hepatitis B means the infection, you just got exposed and this is kind of moving through your body. You may not even know you have it, may not even know you've been exposed. Or you may be that person who ends up being so ill that you need to be hospitalized. With chronic hepatitis B, what we're concerned about is that it's a lifelong infection, and this can lead to liver damage, cirrhosis, cancer, and even death. What are some of the things that somebody might feel if they are infected with hepatitis B? Fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, clay-colored bowel movements, joint pains, jaundice, which is that yellow coloration in the skin or eyes. Now, if you have been exposed to hepatitis B, what do? Well, you call your doctor or your local health department immediately. Infection with hepatitis B can be prevented, as stated before, by the hepatitis B vaccine. You could also use the hepatitis B immune globulin as soon after exposure as possible, ideally within 24 hours, to decrease the risk of getting infected. Now, how do we treat it? Prevention is the key, but the vaccine can be given to newborns and at-risk individuals with no history of prior vaccination. Now, when a patient has chronic hepatitis B, you're going to have a lot more that is done for them: vitamin therapy, steroids, enzymes, all kinds of stuff. And that's usually a patient referred to the gastroenterologist for management. Thank you for joining us. Subscribe to Period Stories.